Now, in continuation with the art of infant feeding, so with these basics, now we will look into some of the case studies, and through the case we will try to understand different aspects of infant feeding, and look at this case very carefully and just read this case. Okay, a primary mother with no risk factor delivered by LSCS at a maternity home. So this is a primary mother, and she is not having any high risk pregnancy and all, but she is delivered by LSCS in a maternity home. And now baby is a term baby and weight is about 2.9 kg. This baby is a term baby and the weight of the baby is 2.9 kgs, and mother is kept in the recovery room for 1 hour, and baby is weighed and vitamin K was given. Okay, बच्चे का जो weight था वो 2.9 kg था. Mother is kept in the recovery room for 1 hour, and baby is weighed normally, and then vitamin K is also given. Now both mother and the baby are shifted to the room after some time. थोड़ा देर के बाद जो है वार्ड के लिए उसको शिफ्ट कर दिया है. And mother is under sedation and the baby is sleepy because LSCS was given, that LSCS was done, that's a spinal anesthesia might have been given, and therefore the mother is under sedation and also baby is feeling very sleepy. The baby's grandmother complains that baby is not feeding well on the mother's breast milk and mother has no milk. This is a complaint of the grandmother. Grandmother is very eager now. Grandmother is very eager and she is complaining that the baby is not feeding well. Now it's only after 1 hour or 2 hours after birth, and complaint of the grandmother is baby is not feeding well on the mother's breast milk, and according to grandmother she is telling that mother is not having milk. The milk is not coming for her. Now in the meantime the staff nurse also noticed that grandmother is feeding with the honey to the child. Okay, so staff nurse also noticed that the grandmother is feeding some amount of honey to the child. The question number 1 is, what is the role of prolacteal fields or prolacteal field? Whether there is any role of prolacteal feed or not. And later grandmother was convinced that she should not give any types of this type of prolacteal feeds and all, or prelacteal feed or prolacteal feed. And now the grandmother is telling that the baby is not latching well and mother is worried. ठीक है, दिस इज द स्टोरी नाउ. अभी तो ग्रैंडमदर ये बोल रही है, ग्रैंडमदर को बाद में समझा गया कि इस तरीके से प्रीलैक्टल या प्रोलैक्टल फीड देने से बच्चे का फीडिंग इफेक्ट हो जाता है, तो इसलिए आप मत दे दीजिए. तो उसने मान लिया. बट अभी उसका जो कंप्लेंट है कि बच्चा जो है अच्छे से पकड़ नहीं रहा है, बच्चा जो है अच्छे से पकड़ नहीं रहा है, और इसकी वजह से मदर जो है वरीड है, बच्चे को फीड नहीं जा रहा है बोल के मदर वरीड है. Now this is the whole story in this case. Okay, it will explain so many things, especially prolacteal feed and prelacteal feed जो बताया यहाँ पे, prelacteal feed. And if you see in Ayurveda, in terms of Ayurveda, okay, Madhughruta Prashana is done, and that is a type of prelacteal feed actually. Prelacteal feed, isn't it? So now this question has to be also answered in this particular part. Okay, what contemporary science says and what Ayurveda says and what are the importance, etc. Now let us see this case very carefully, one by one. And to some extent the grandmother was made as villain here, but grandmother was true according to her own sense. Let us see what is the problem. Now, prelacteal feeds has no benefit other than causing obstruction for early initiation of the colostrum and also breastfeeding. It delaying the exclusive breastfeeding and increasing the chance of contamination. Now this is what contemporary science says, that if you give any type of free lacteal feeds, pre-lacteal means breast milk देने से पहले अब जो भी feed देता है, ठीक है, pre-lacteal feed. Post-lacteal means along with the breast milk or after breast milk, whatever you are giving, ठीक है, post-lacteal feed. Prelacteal feeds do not have any benefit. This is what modern science says. Prelactal feed do not have any benefits other than causing the obstruction for the early initiation of the colostrum and breastfeeding, and it also delays the exclusive breastfeeding, and also it increases the chance of contamination. Every point which is given here is absolutely correct, no doubt. Okay, but we have to now substantiate what Ayurveda is telling. So according to modern science, when you give any other prelactal feeds, maybe in the form of honey or some other thing, there is every chance of contamination, because it is not ensured that the person or mother or whatever grandmother who is giving the prolactal feed, she is completely maintaining the aseptic procedure. So there is every chance of contamination. We know that septicemia, etc., anything can occur. That's right. It also delays the exclusive breastfeeding. And this is also right. Okay, if you give the prelactal feed, baby is habituated for that, and baby is enjoying the prelactal feed, and it will not suck the breast, and the total production of the breast milk will be delayed, and exclusive breastfeeding will is also delayed. Yes, this is also right. There is obstruction in the early initiation of the colostrum. Yes, the baby is not receiving that particular colostrum, which is very important for the baby. This is also right, absolutely right, because colostrum is the breast milk which is coming in the first 3 or 4 days of the life immediately after delivery. So that will be missed by the baby. Okay, and it causes obstruction for the normal way of breastfeeding. That means normally baby we used to suck, then there was suckling reflex, and then prolactal reflex, then prolactin reflex, oxytocin reflex. So it's a complex process which involves so many systems like neurological system, hormonal system, musculoskeletal system, psychological system, etc. Okay, so now that coordination will be delayed, and as a result breastfeeding will be delayed. Everything is right, but we know that in Jatakarma Samskara, immediately after birth, Charaka very clearly says Madhugrita Prashana should be done, and this will be followed by the breast milk feeding. Now if you want to answer for this question, the Madhugrita Prashana which is given in Jatakarma Samskara as explained in Ayurveda, it is not given as a prelactal feed. It is not a prelactal feed. A small amount of the madhu and a small amount of the grita is given mixed with the suvarna or some other drugs, vacha, etc. drugs, and it is given for the licking. And the purpose here is not for the prelactal feed, rather it is for the testing of the sucking and rooting reflexes, and as well as swallowing reflexes of the baby. Number 1. Number 2, it is a very small amount, as we think. See, as the generation passes, or when it is practiced by some other unexperienced people, they may give a lot of amount of honey for the baby. Okay, otherwise what is explained in Ayurveda is, it is a very small amount of the honey which is given. It is not for the feeding purpose actually. It is for the purpose of checking the feeding reflexes. And the small amount of the feed which is given in the form of madhu and grita, it will also going to act as a trophic effect. Trophic feed means small amount of the feed which is given to the baby immediately after the birth in order to stimulate the gastric mechanism, or gastrointestinal motility. So that for trophic feed purpose. Okay, so trophic effect will be achieved by this small amount of the feed. Okay, and third one is, as we know that it has got some immunological aspects also, which we will discuss, and is also based for the Swarna Prashana also. Madhugrita, which will act as a Sanyoga Viruddha or Matra Viruddha, etc. It acts as a Viruddha Ahara, and that Viruddha Ahara will go into sensitize the body immune cells. Okay, early sensitization of the body immune cells. So these are the 3 important purposes why Ayurveda told the Madhugrita Prashana, and we should not take that Madhugrita Prashana as a feed. It is not the feed. It is a very small amount of the food substances, that is madhu, which is rich in carbohydrate and sucrose, etc., whereas grita, which is rich in the calories, okay, and also gives the lubricating effect, and also serves as a immediate source of energy to the baby. That is also very small amount, and it is not told that it should be given continuously. It is only given for one time. Okay, once you are ensured that the baby is having good feeding reflexes, again there is no need to give the madhu and grita prashana. It's only one time procedure. Okay, one time procedure. So therefore, here anyway, the grandmother may not be knowing much of the scientific things. He may be somewhere misled by the previous experiences. So she has given some prelactal feed in the form of honey, probably she may not be knowing these benefits and right way of doing that. Anyway, now the mother is telling that baby is not catching the nipple properly or not holding the nipple properly. And now this is the problem with the latching. We will call it as latching, Latch. And there is when the baby is not able to put the areola or the black portion of the breast into the mouth, so that we usually will say that's a problem in latching. Okay, latching. So whenever mother is giving first time feed to the baby, so you have to observe 4 important things. Okay, and that can be remembered as STOP. STOP, stop. S stand for sensorium. You have to look into the sensorium of the mother and as well as sensorium of the baby both. Then T, temperature. You have to look into the temperature. Third one is whether the baby is able to breathe properly or not, oxygen. And P for perfusion, whether the perfusion of the baby is okay. And S for sugar. So that means whether baby is receiving good amount of the sugar or not. So these are the 4 important stops. Stops. So it is not stop, stops. Okay. S for sensorium, T for temperature, O for oxygen, P for perfusion, and S for sugar. And these are the 5 important things that you have to see whenever mother is giving the feed for the baby for the first time. Okay. Latch score is very famous and helpful to see whether the breastfeeding is proper or not, technique is proper or not. Okay, it is revised in 2018. Okay, previous one is again revised in 2018. Now, what is latch score? If you want to details of the latch score, it contains following components. Okay, see, these are the important factors related to the latch score. Latch means LATCH. L stand for latch, A stand for audible swallowing, and T stand for type of nipple, then C stand for comfort, and H stand for hold. So सीधा है कि जब बच्चा पहली बार फीड करा रहा है बच्चे को, and these are the 4 or 5 points that you have to always observe, whether the baby is latching or holding the areola properly or not. Number 2, when the baby is consuming the breast milk, do you find an audible sound of swallowing? जैसे अब निकलते वक्त जो sound एक आता है, वो sound सुन रहा है क्या? That has to be seen. And T for type of the nipple. Nipple retracted है, inverted है. Okay, so this has to be small nipple है, deformed nipples है. So that has to be seen because nipple problem also leads to this problem. Then C for the comfort. Whether the baby is comfort, whether the mother is comfort, both has to be seen. Okay, so then hold, whether the baby was hold in a proper position or not. So these are totally called as latch score. Okay, so latch score के हिसाब से हम grading करते हैं कि whether the feeding is proper or not. Okay, now latch score may be 0, maybe 1 or maybe 2. So first latch, baby is too sleepy, suppose, or there is no sustained latch, or suck. Latch is nothing but sucking, है ना? एक type से it's nothing but sucking, holding the areola and sucking it. Okay, so if the score is 0, if the baby is too sleepy and there is no sustained latch, अच्छे से नहीं पकड़ रहा है, कस के नहीं पकड़ रहा है, और एक बार पकड़ के छोड़ रहा है, or not able to suck, then the score is 0. Okay, but the score is 1 if the baby is repeatedly doing some attempt for latching or sucking and hold the nipple in the mouth. भले ही वो ठीक से suck नहीं कर पा रहा है, but it is holding the nipple in the mouth, then the score is 1. Okay, then score is 2 if the baby is able to grasp the breast and the tongue down, lips flanked, and rhythmical sucking. If the baby is showing some rhythmic sucking of the areola or breast milk, so then the score is 2. This is first thing. Okay, then A for audible swallowing. So when the baby is sucking, in the meantime there should be sucking, swallowing, rooting, sucking and swallowing. These should be always in coordination, isn't it? That is very important. That is what we are checking in the Madhugrita Prashana by checking the feeding reflexes. ठीक है, सिर्फ जो है आप फिंगर अंदर डाल के उसका सकिंग अगर चेक कर रहे हैं तो आप स्वैलोइंग देख नहीं सकते हैं. बट मधुघृत प्राशन करते वक्त क्या होता है कि आप सकिंग swallowing रूटिंग सकिंग के साथ you can also observe the swallowing. That is one of the benefits. Okay, so what is the contemporary science says that you check the sucking and rooting and swallowing reflexes by putting the clean finger inside the mouth. Okay, that may be the good method, but it is not a good method to see the swallowing. Swallowing के लिए कुछ method food तो चाहिए. So there are small amount of madhugrata given helps to understand whether the swallowing is good or not. Anyway, so while swallowing, whether there is an audible sound or not. If there is no sound at all, the score is 0. Okay, and there is some good amount of swallowing. Swallowing अच्छे से हो रहा है थोड़ा बहुत stimulation देने के बाद, then the score is 1. And there is a spontaneous and intermittent swallowing. Normally it is seen. ठीक है, sucking और rooting है, sucking है, उसका swallowing है, अच्छे से चल रहा है, then the score is 2. Then look at type of the nipples. Okay, if the type of the nipple is inverted, then the score is 0. If it is flat nipple, then score is 1. And if it is averted after stimulation, उसको बाहर निकाल दिया गया, ठीक है, it was lifted outside, averted after stimulation, then the score is 2. That means whenever the baby touches the nipple, and when the mother is trying to feed the baby, so nipple should be there in the averted position, should not be inverted. If the inverted, he is not able to do the same. Now another one is comfort level. Now you look at the comfort level, whether the baby is comfort, whether the breast is engorged, cracked, whether there is any bleeding, then large blisters are there, or any bruises are there, any other injuries are there. So this we have to see. If such things are there, breast is engorged, cracked, bleeding, etc. is there, then the score is 0. Okay, now suppose if the breast is filling, it is red, and small blisters are there, and some of the bruises are there, then the score is 1. And if the breast is soft and non-tender, and baby can comfortably take the can consume the breast milk, then the score is 2. Last score. Okay, last one is hold. How to hold the baby. Now minimal assistance is required to hold the baby. Mother is able to feed herself, only minimum assistance is required, maybe staff nurse or then etc. Then later mother holds, so then the score is 1. If there is no assistance required, mother herself is able to feed the baby comfortably. She is holding the position, she is holding the baby in position, in a comfortable position, in the recommended position properly, and then the score is 2. So this is a very useful index system, scoring system. Okay, so which helps to see whether the first feeding is proper or not, and this is called as latching score. L for latching, then audible, so A for audible swallowing, T for type of nipple, C for comfort, and H for holding. Now if this score is more than 7, 5 आइटम था टोटली, सो दो के हिसाब से 10 होना चाहिए था, बट इफ द स्कोर इज मोर देन 7, इट सजेस्ट दैट द रिक्वायर फर्दर मॉनिटरिंग, आगे भी उसको मॉनिटरिंग करने का जरूरत है. नाउ वी हैव गॉट सो मेनी न्यू बॉर्न्स इन अवर IPD, सो टुमारो ऑनवर्ड्स यू कैन फॉलो दिस लैच स्कोर, especially for the primaries. Okay, so if the score is 7, then it requires further monitoring, and teach all the staff and student to take the latch score. This is very important. आप अपना जूनियर को सिखाओ, आप भी सीखो latch score. Now this is one thing. Okay, so this is a question of the grandmother. Grandmother is saying the baby is not holding the that means taking the breast milk. She is not able to feed. Mother is not able to feed. So you have checked the latch score, and accordingly you are guiding that particular mother. Okay. Now same mother is also asking you another question, that how often you can feed. कितना देर तक पिलाना चाहिए. And what she is asking is whether she is asking, should I feed at any time, or whether I have to go for scheduled feeding. That means every 2 hourly once I have to feed, every 3 hourly once I have to feed, or anytime whenever the baby is crying I have to feed. So this is a question of the mother. Now you need to answer this question also. Now you have to understand the hunger cues. Now first of all, doctor, that means you, doctor should understand what is hunger cues. Then we have to explain that hunger cues to the mother, and we have to make her expertise to understand the hunger cues. And this is what happens when the baby is hungry. This occurs in the sequence. Now see, usually हम बोलते हैं कि बच्चा जब रोता है तो उसको दूध पिलाना चाहिए. ठीक है, रोने तक आप क्यों वेट करते हो, isn't it? अगर कोई भी चीज़ आपको चाहिए, आप अपना मदर से पूछ रहे हो मुझे ये चाहिए, मदर नहीं दे रही है, मदर नहीं दे रही है, तो आपको गुस्सा आ गया, फ्रस्ट्रेशन हो गया, आप रोना शुरू कर दिए। जब आपको रोना धोना बहुत ज़्यादा हो गया, मदर ने बोल दिया चलो मैं दिला देता हूँ उसको, तब आपका मन उड़ गया, आप बोलेंगे नहीं चाहिए मुझे, अभी इतना रोना धोने के बाद क्यों चाहिए मुझे। The same thing also happens to the baby also. Now, the concept what we think that जब बच्चा जब उसको भूख लगेगा वो खुद रोएगा, जब रोएगा तो हम ब्रेस्ट मिल्क देंगे, ठीक है, ये एक मेंटालिटी रहता है। बट वाई इफ द बेबी इज क्राइंग मीन्स बेबी हैज रीच द स्टेज ऑफ फ्रस्ट्रेशन, वो यू आर मेकिंग द बेबी फ्रस्ट्रेटेड, एंग्री, और उसको पहले गुस्सा दिला के उसके बाद उसको फ्रस्ट्रेशन करा के उसके बाद क्यों फीड कर रहे हो आप। वो फीड करेंगे तो भी वो फीड सक्सेसफुल नहीं होगा, बच्चा इतना अच्छे मन से लेगा नहीं। ओके, दैट्स द डिफरेंस बिटवीन द हंगर क्यूज। यू हैव टू आइडेंटिफाई द हंगर क्यूज। इंटेलिजेंट मदर शुड अंडरस्टैंड हंगर क्यूज। हंगर क्यूज मीन्स these are the signs or characters or body movements or body language of a baby who is hungry. You have to identify this before crying. Crying is the next stage. पहले तो जो है बच्चों को भूख लगेगा, वो बहुत सारे मूवमेंट्स करेगा, है ना, बहुत सारे बॉडी लैंग्वेज दिखाएगा। अगर उसको आप आइडेंटिफाई नहीं किए तब बच्चा क्राई करना शुरू करेगा। इफ़ यू आइडेंटिफाई दैट एंड राइटली यू हैव स्टार्टेड द ब्रेस्ट फीडिंग, देन दैट्स कंसिडर्ड एज द बेस्ट वे ऑफ ब्रेस्ट फीडिंग, बिकॉज आपने बच्चे को गुस्सा दिलाने से पहले ही जो है फीडिंग शुरू कर दिया। दैट्स द बेस्ट वे। ओके, सो ए मदर शुड नो हाउ टू आइडेंटिफाई द हंगर क्यूज, and it's the duty of the doctor to a primary mother to explain these things. Okay, so now this occurs in a sequence. एक बच्चे को भूख लगना शुरू हो गया, now baby has started hungry. Okay, gradually baby is getting into the stage of hungry, and what are the different changes that takes place in the body language and the movement of the baby, and that is called as hunger cues. See, a baby who is hungry is often opens the mouth. If you observe the baby, थोड़ा बहुत ऐसे मुंह को ओपन करेगा, often open the mouth, and there is a turning of the head को turn करेगा, okay, then there will be a stretching, body stretching will be there, then he put the hand onto mouth, okay, and there will be some of the physical movements, etc. Okay, अगर if this is not identified, then there will be a crying, agitation, turning red, etc. So this is the first step where mother has to identify. Now first baby open the mouth, okay, then there's a turning of the head turning towards the breast of the mother. So बच्चा जो है अभी मदर का ब्रेस्ट को देखना शुरू करेगा frequently. Okay, so then he is stretching, that means he is leaning towards the breast, then he start putting his hand to the mouth, and there will be so much of physical movement, है ना, कि वो बहुत सारे physical movements को दिखा रहा है। Okay, and if this is not attended properly at this particular stage, then baby go for crying, okay, and turning red or agitated, and you should not wait for crying. Before that only you have to identify this and you have to give the breast feeding. Crying is considered as the last expression. Crying is only last expression, it is not the first expression. So by that baby is angry, so mother should understand this starts feeding before crying. Yes, and this is called as demand feeding. ओके, सो दिस इज कॉल्ड एज बेबी डिमांड कर रहा है तो उस टाइम आप फीड कर रहे हो, क्राई करने के बाद नहीं है। उसका हंगर क्यूज यू हैव टू आइडेंटिफाई एंड देन यू हैव टू स्टार्ट द फीडिंग, एंड दिस इज कॉल्ड एज डिमांड फीडिंग। एंड मदर शुड बी एम्पावर्ड विद दीज स्किल्स. मदर हैज टू आइडेंटिफाई दीज स्किल्स. इफ द मदर इज कीनली ऑब्जर्विंग द बेबी, डेफिनेटली इट इज नॉट अ बिग टास्क टू मदर टू अंडरस्टैंड दीज स्किल्स. Okay, she has to watch the baby carefully for 1 or 2 days, then everything will be understood for the mother. Now another question which is asked in the same case, that is no milk is coming, है ना, ग्रैंड मदर का दूसरा एक क्वेश्चन था वहाँ पे कि मदर को मिल्क नहीं आ रहा है. सो हाउ टू इंक्रीज द मिल्क, now on demand feeding mother is asking how to increase the milk, and she is asking shall I take any galactolol. तो मदर को मिल्क नहीं आ रहा है, वो प्राइमरी है, ठीक है. सो शी इज टेकिंग वेदर आई हैव टू टेक एनी galactolol मीन्स ब्रेस्ट मिल्क इंक्रीजिंग ड्रग्स. Now, actually a good amount of the water or liquid taken by the mother is a very good galactolol. ठीक है, जो गुड अमाउंट ऑफ द फ्लूइड और जो पानी जो मदर पीती है, गुड अमाउंट ऑफ द लिक्विड लेती है, सो दैट एक्चुअली इज अ वेरी गुड galactolol. वो ब्रेस्ट मिल्क को बढ़ाएगा, बिकॉज ब्रेस्ट मिल्क इज आफ्टर ऑल मेड बाय द लिक्विड्स. ओके, इट्स लिक्विड. नाउ again, there is a very interesting aspect that in the contemporary science, they do not have any good explanation for galactolog. Galactolog का कुछ अच्छा explanation नहीं है. Of course, they do not have actually galactolog. Some of the drugs they are using as galactolog is used for the other purpose. For example, metoclopramide. Metoclopramide is considered as one of the anti-emetic drug. It has got its own adverse effects, side effects, etc. And one of the side effect of the metoclopramide is hyperprolactinemia. So prolactin का level बढ़ेगा और उसके बाद breast milk secretion बढ़ेगा. So some of them used to give metoclopramide. I don't know nowadays. Previously they used to give it. Now this is a wrong practice again, because metoclopramide is not a drug which has to be indicated for the galactologs. They are using the adverse effects of that particular metoclopramide for the galactolog purpose. So that's not a good approach. Therefore, I am telling they do not have a good understanding of galactologs. Okay, so of course, a good amount of the fluid that you are taking, that is always add for the breast milk. That's good. Nutrients, that's good. But whether do you have any particular drugs which directly increases the prolactin level? Prolactin is made for the is important for the production of the breast milk, isn't it? But here Ayurveda explanations are much higher or much scientific than the explanation given in the contemporary medical science. Why I mean say we have got so many drugs. One of the because the classics of Ayurveda explains Tanya Vardhaka drugs. Okay, we have got many drugs, Virana, Shashti, Shalika, okay, then Shatavari. Okay, we have got many drugs which are proved for their prolactin increasing effect. One of the prolactin inducing drug is Shatavari. Shatavari is one of the best galactolog to increase the breast milk. We have got similarly Virana, Shashti, Shali, etc. Lashuna is the best galactolog. And many other the vegetable drugs are there. So, but what modern contemporary science says that some of the drugs are having the galactolog effect and mostly some of the placebo effect. Okay, the breast milk the production of the breast milk may be related to the psychological factors. We do agree with that. But what I mean to say is Ayurveda has got very good established Stanyavardhaka drugs. It's okay, contemporary science is having a disadvantage here. They do not have such drugs. But fortunately in Ayurveda, we have got a very good galactolog drugs and we have to utilize for the purpose of the benefit of the society. Okay, so it's not a matter of superiority or inferiority. And the concepts of Ayurveda itself is formulated in similar fashion. The rasa is formed more. One of the upadhatu of the rasa dhatu is stanya. So once you increase the rasa dhatu by different methods, definitely stanya will also increase. That's a very clear-cut concept. So we have to put confidence and hope to the mother. This part is okay. Okay, this is psychology and faith, psychology, confidence, okay, then motivation, all these helps to increase the breast milk. That's okay. Apart from that, some of the food and also some of the drugs are also there in Ayurveda, which will going to increase the breast milk secretion, unlikely to that of the contemporary science. Now, how to increase the breast milk? That is prolactin reflex. Prolactin is produced after the feed to produce the next feed. So this part, so this is the first case. Okay, so almost all we have answered all the questions of that grandmother in this question. In this case, first we have seen the latching score, then we have seen why this prolactal feeds or prelactal feeds should not be given or it should be given. What are the advantages, limitations, etc. Then we have seen how to increase the breast milk also. In the next class, we will continue with another important case. Thank you very much. We will again meet in the another class.